Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we are going to continue our discussion on peptic ulcer and its therapy. So, starting with our discussion on therapy of peptic ulcer, you have to keep in mind that before discussing the pharmacological aspects, I will discuss the non-pharmacological aspects of treating peptic ulcer. So the first thing we have to assure the patient is to avoid stress, to avoid spicy food, and to avoid smoking. So 3S: stress, smoking, and spicy food. The patient has to avoid if they are suffering from peptic ulcer. The next step is to avoid NSAID use and to use the selective COX-2 inhibitors if it is very necessary for them. And then food. Now the food should not be spicy and the patient should avoid spicy and fried food. One more important thing is that the frequency of the meal intake. If the patient feels relief in after taking a meal, then they can make the meal size smaller and take the meal 6 times per day to extend the time of food stay in their GIT. Remember that we are not going to increase the quantity, we are just going to increase the frequency of meal intake in the patient so that they would feel relief. In case of those patients that feel relief after food intake, and usually they are patients of duodenal ulcer. So students, now we are going to discuss the therapy of peptic ulcer disease. Starting first of all with HCl, which is an aggressive factor. So we are going to discuss those agents that can neutralize the acidity of the stomach. So talking about antacids, we have different types of antacids. We have sodium bicarbonate, we have calcium carbonate, and we have also salts of magnesium and aluminium. So first of all, starting with some discussion about the sodium bicarbonate. You can also see in this figure. Sodium bicarbonate, it actually rapidly neutralizes the acid in the stomach, but it has a drawback that it is absorbed systematically. So sodium bicarbonate, it rapidly neutralizes the acid. You can see in this figure that the intake of sodium bicarbonate, after it in the stomach, this bicarbonate, it combines with the proton in the stomach and forms carbonic acid, which then splits into water and carbon dioxide. But this sodium, it moves ahead and then in the intestine, it is reabsorbed back by the body. And we know that sodium, it has an important role in increasing the blood pressure. So retention of sodium can be responsible for increasing the blood pressure in susceptible patients. So in rebound acidity, the patient actually, after intake of antacid, within half an hour, he starts feeling even more acidity as compared to what it was before the intake of antacid. And the last point which I want to make it very clear to you, that remember that antacids, if any patient takes any drug consecutively with antacids, it is going to cause chemical complex, which is also known as chelation. So the patient should not use any other drug or take any other drug at the same time with the antacids. So there should be at least a difference of half an hour in most of the drugs because it causes a chemical complex with those drugs. So now we are going to discuss the second aspect, and that is those drugs that are anti-secretory, or we can say those drugs that decreases the HCl secretion. So first of all, we are going to discuss H2 receptor blocker or histamine receptor blocker. As you can see in this figure has been discussed in the previous video in detail. Some of the examples of H2 receptor blocker are cimetidine, famotidine, nizatidine and ranitidine, as you can see in the figure. And this group is a selective H2 receptor blocker. As previously we discussed that H2 receptor not only by histamine but it is also stimulated by gastrin and acetylcholine. So if we block H2 receptor, at least 70% of the HCl secretion is inhibited by using H2 receptor blocker. So this group H2 receptor blocker, which consists of drugs like cimetidine, ranitidine, famotidine, they are used in stomach ulcer, duodenal ulcer and even stress ulcer. Stress ulcer are actually caused by excessive HCl secretion due to any stress. One such example is a patient who is going to undergo any kind of surgery, and due to persistent thinking about that event, eventually on the day by day HCl secretion starts to increase, and at the day of the surgery such outburst of HCl occurs that it causes ulceration. So these are the types of ulcers in which H2 receptor blocker is effective. And it is also used in NSAID-induced ulcer. NSAID-induced ulcer occurs in patients who are chronic users of NSAID in painful conditions like rheumatoid arthritis. It is also used in Zollinger-Ellison syndrome. Now, what is this Zollinger-Ellison syndrome? Now, remember that we discussed about gastrin hormone, which is responsible for stimulating the parietal cell to increase or release HCl. And remember that we discussed that G cells were present in the duodenum, in the pancreas and also the stomach. So, if gastrinoma occurs, that is a tumor in the G cells, so this result in excessive stimulation of gastrin hormone, and that ultimately will stimulate the parietal cells to release massive amount of HCl. So you can see in this figure, ultimately by giving H2 receptor blocker, we are actually decreasing the excessive HCl secretion that is occurring in this syndrome. Now if we compare the H2 receptor blocker with antacid in case of gastroesophageal reflux disease, the antacid, they actually neutralize the acidity instantly, while it takes about 45 minutes for the H2 receptor blocker to neutralize the acidity. So in the case of treatment of peptic ulcer by H2 receptor blocker, they are used for a period of 6 weeks, and after that endoscopy is done to see that is there any improvement in the ulcer healing, and if there is some improvement, then that dose is used for 6 months to completely heal the ulcer, because the ulcer needs time to heal, and that excessive HCl secretion, if not inhibited or decreased, will not allow the ulcer to heal. So now we will discuss the next drug that is also an anti-secretory drug that inhibit the HCl secretion, known as proton pump inhibitor. This group inhibits the hydrogen potassium ATPase pump, and you can see that those drugs that are present in this group, their name end with zole: esomeprazole, omeprazole, pantoprazole. So this group inhibits this pump, and it inhibits completely the secretion of HCl. This inhibition is because it irreversibly binds with this pump